Thank you. Let's go live in a minute.
Yeah.
All right, everybody, welcome. A hearty good evening to everyone, and welcome to our session on the topic of twin pregnancy. We are pleased to have Dr. Padmini Silpa among us to educate us on the topic. Dr. Padmani is an experienced obstetrics and gynecologist, and as well as an infertility specialist associated with Apollo Cradle, Kondapur. She also offers her services in treating other women issues. Now, she's going to be enlightening us on the topic at hand, and we are pleased to have her as a guest. Ma'am, you may begin. Thank you so much.
Thank you for the kind introduction. Today, good evening, everyone. Today, we are going to, good evening, everyone. Today, we are going to talk to you about a very important topic: twin pregnancy. See, being pregnant itself is very exciting, and if a woman is carrying twins, two babies at the same time, then it is like double exciting. At the same time, carrying twins is very challenging also. See, the incidence of twins has increased tremendously in the last 3 decades. This is just because of assisted reproductive techniques as well as the advanced maternal age, like the because most of the women are planning their pregnancies at a later age. So these are the two reasons, main reasons why there is a tremendous increase in the incidence of twins in the last 3 decades. So even the major medical advances have improved maternal and fetal outcomes. Still, we face so many challenges in the mother as well as the baby in a woman who is carrying twins. So in the next 20 minutes, let us talk about the twin pregnancy. What is twin pregnancy? What are the different types of twins? What are the complications? And what are the extra precautions which a mother who is carrying twins has to take care? Coming to what is twin pregnancy, any mother who is carrying more than two babies at the same time, we call it as twin pregnancy. It is a type of multiple pregnancy. It's one of the most common type of multiple pregnancy. There are two different types of twins, identical twins and non-identical twins. Identical twins or those twins who are similar to each other. They carry the same genetic material and they belong to same sex. These twins form when a single fertilized egg divides into two embryos and they implant in the womb. So we call these sort of twins as monozygotic twins also. There are three different types of monozygotic twins depending upon when the fertilized ovum divides. One is DCDA twins, where the fertilized ovum, if it divides between 1 to 3 days of the fertilization, this results in DCDA twins, where the twins have each twin has its own placenta and its own amniotic sac. These twins account to almost 20 to 25% of monochorionic twins. The second most common variety is MCDA, monochorionic diamniotic twins. This happens if the fertilized egg divides between 4 to 8 days of the fertilization. These twins, they shape the placenta, but each twin has a different separate amniotic sac. This accounts to almost 70%, two-thirds of monozygotic twins. And rarest variety is MCMA twins. We call it as monochorionic monoamniotic twins. These twins happen if the fertilized ovum divides between 1 to 2 weeks after fertilization. Here, both the twins they share the placenta as well as the amniotic sac. There is a very rare variety of conjoined twins where if the fertilized egg doesn't divide completely and it divides partially, and this division happens after 2 weeks of fertilization. These twins they get attached at some point of the body, for example near the head or near the thorax, and this is one of the rarest variety which we see in only 1% of twins. The second variety of twins is fraternal twins or non-identical twins. Here, the twins they don't resemble each other completely. They don't share the genetic material also completely, and they may or may not belong to same sex. They may belong to same sex, or sometimes they may be of different sex also. Here, What happens is in a menstrual cycle, if sometimes more than one egg forms, and these two eggs, if they get fertilized with two sperms, they develop into two embryos, and this results in dizygotic twins or fraternal twins. Then coming to the risk factors, so let us see what are the causes, what are the risk factors which can result in the increased incidence of twins. See, some women may have a little bit extra chance of carrying twins than other women. When we are looking at these factors, the first and foremost is age. If the mother, while she's planning her pregnancy, the mother is above 35 years of age, she may be, releasing more than one egg in a menstrual cycle, and this type of woman can have a little bit higher chance of carrying twins when she becomes pregnant. Second is heredity. If there is a family history of twinning, especially on the maternal side, this type of woman also can have a little bit extra chance of carrying twins. Next comes ovulation induction drugs, fertility drugs. See, recently many women has to have some sort of support while planning for pregnancy, and if we use ovulation induction drugs where more than one egg can develop, this also can result in multiple pregnancy. And in assisted reproductive techniques like in vitro fertilization procedures also, where suppose in case we transfer more than one embryo at a time, this results in multiple pregnancy. So especially this type of procedures may result in dichorionic twins, dichorionic diamniotic twins. And coming to the complications, see, twins pregnancy is a high risk pregnancy. We see many complications in the mother as well as the baby. Coming to the maternal complications, a woman who is carrying twins is at high risk of having hyperemesis gravidarum. That is, she might be experiencing more nausea and vomiting during pregnancy, excessive nausea and vomiting during pregnancy, and sometimes she may require hospitalization also for this, where she needs to be managed with IV fluids and antiemetics. Second and most common complication which we come across in a woman who is carrying twin pregnancy is premature labor, preterm labor. What is this preterm labor? Usually women goes into labor or gives birth to a baby between 37 to 40 weeks of pregnancy. Suppose in case if a woman is giving birth to a baby before 37 weeks of gestation, we call it as preterm labor. The twin pregnancy, women who is carrying twin pregnancy is at a higher risk of having this preterm labor. Almost 60% chance of going into this preterm labor, whereas a woman carrying singleton pregnancy is only a 10% chance of going into preterm labor. And this preterm labor is very taxing to the mother as well as the babies. Then comes medical disorders like preeclampsia and diabetes, gestational diabetes. Women who is carrying twins is at higher risk of developing preeclampsia, especially 2 to 5 times more risk of developing preeclampsia. And this also happens a little bit earlier, as well as it will be more severe also in a woman who is carrying twins. Gestation diabetes mellitus, yes, a woman who is carrying twins is at a little bit more risk of developing gestational diabetes mellitus also, and she also has more chances of developing anemia during pregnancy. That is the reason why we keep on, counseling the woman who is carrying twins to take iron rich diet and also to take her iron supplements religiously. One more complication which we come across is miscarriage. The miscarriage rate is also slightly higher in twins, 1 in 8. Miscarriage rate is also slightly higher, it is 8% miscarriage rate is there. And postpartum hemorrhage. This is again one dreadful complication which we come across. Usually, what is postpartum hemorrhage? Any excessive bleeding which happens after the delivery of the baby, we call it as postpartum hemorrhage. The woman who is carrying twins is slightly at a higher chances of having this postpartum hemorrhage complication because of the over-distended uterus as well as the larger surface area of placenta. So that is the reason why whenever we are delivering twins, we try to give medications to prevent this postpartum hemorrhage prophylactically itself. Coming to fetal complications, uh, fetal complications, the first and foremost complication which we should talk to you about coming to twin pregnancies, premature babies. As we have discussed already, because prematurity and premature labor is one of the most common complication in twin pregnancy. We keep on coming across this preterm babies, women giving birth to preterm babies. So what happens? What are the main issues with the preterm baby? These preterm babies, in these babies, the organs are not well matured, coming from the baby's lungs, brain, gastrointestinal system. So these babies will have issues, difficulties with breathing, feeding, and sometimes they will have problems with the eye also. So that and these babies, most of these babies, they require good intensive care, neonatal care support, and growth discordancy. See, twin babies also are at a little bit higher risk of having intrauterine growth problems. Sometimes we keep on seeing that one baby grows better than the other, and we call these sort of twins as discordant twins. And this growth discordancy again is because of placental problems or infection, or in some monozygote twins there can be a condition called twin to twin transmission syndrome again, which leads to this growth restriction babies. One more thing, what we come across in twin pregnancy is congenital anomalies. There is an increased risk of congenital anomalies in the babies when a woman is carrying twins, especially the anomalies pertaining to heart and neurological anomalies like spina bifida. And we also see an increased incidence of gastrointestinal abnormalities in the babies. Then comes, how do you diagnose a twin pregnancy? When a woman is pregnant, usually we do the first in early pregnancy scan around 6 to 8 weeks of pregnancy. This is the scan where we see the location of pregnancy and the number of gestational sacs, and also we try to see the baby as well as the heartbeat. So usually, most of the twin pregnancies are diagnosed in this scan. The early pregnancy scan or viability scan, which we do between 6 to 8 weeks of pregnancy. Once we know that the woman might be carrying twins, we again redo the scan at around 8 to 10 weeks to determine the chorionicity, or else to confirm the chorionicity, because this is very, very important. We should be very sure about whether the babies are sharing the placenta or they have their own placenta, because the complication rate differs between the two sets of twins. The babies who share the placenta are subjected to more number of complications than the babies who don't share the placenta. And coming to the special or extra precautions which a woman has to take while she is carrying twins. See, twin pregnancy, we know that it's a very high risk pregnancy. So once a woman knows that she is carrying twins, it's always imperative for her to book into a center where there is a team of obstetricians who are experienced in managing high risk pregnancies or twin pregnancies, and where the setup has a proper level 3 NSU unit, and the good fetal medicine unit. So it's very imperative for the mother to book herself into a center like this, so that so that she can have a comprehensive care, and any complications which she can come across in the due course can be tackled with duly. After the early viability scan, which we have discussed about just now, then comes the NT scan and double marker, which has to be done between 11 to 13 weeks of 11 to 14 weeks of pregnancy, which where we'll be screening for different genetic syndromes. Then comes the TFA scan at around 19-20 weeks, where we'll screen for congenital abnormalities or physical abnormalities. And after that, once in 3 to 4 weeks, we'll be asking for the growth scans to check for the baby's growth and like her, and any issues in the blood flow to the baby. All these things can be checked in the growth scan. In twin pregnancy, we do a special scan for cervical surveillance scan starting with the 14th week of pregnancy to see the length of the cervix. See, usually the cervix should be somewhere around between more than 3 centimeters. These scans are done once in 3 weeks to check the length of the cervix. In case we find the cervix is shortening, or else the cervix is thinning, or if it is opening up, we try to put a cerclage, that's the stitch around the cervix, to prevent the miscarriages. We call it a cervical cerclage. And most of the twin pregnancies are also given some extra support with progesterones also. Coming to the nutrition aspect, for a woman who is carrying twins, she should take good balanced diet, which is rich in protein as well as iron and calcium. It's always better to take a multivitamin daily, and at least 300 600 kilocalories extra should be taken. And weight gain, yes, a woman who is see the amount of weight a mother can gain depends upon her pre-pregnancy BMI. A woman with normal BMI can gain about 70 to 24 kgs, and a obese woman can gain about 11 to 17 kgs while carrying twin pregnancies. Coming to the physical activity, what level of physical activity can a woman with twins can do? Usually, staying active is very, very important while being pregnant. But at the same time, when a woman is carrying twins, it is better to avoid strenuous exercise or strenuous activities. You can engage yourself in a light exercises like walking after discussing with your healthcare provider. Then coming to the other set of extra precautions, see one thing which a woman carrying twins should be aware of is warning signs about premature labor, because as we have discussed earlier, preterm labor is one most common complication a woman carrying twins can have. So we have to be very careful about the warning signs of preterm labor. Usually, we keep on counseling the woman about these warning signs at every visit so that she can pick up those signs and symptoms and can comfort the hospital at the appropriate time. See, usually any labor pain, any abdominal pain, or any excessive vaginal discharge, uh, some sort of pressure in the vagina, these are the things which a woman should pick up just like that, and then she should approach a healthcare provider, because usually, suppose in case we feel that the woman is going into preterm labor, we try to give medications depending upon the gestational age. Suppose in case she's less than 32 weeks or 34 weeks, we try to stop the preterm labor by giving medications and try to improve the outcomes of the baby by giving steroid covers and other medications. So even a single day gained will be very beneficial for the baby. Uh, Coming to the end of the topic, we'll talk a little about the mode of delivery. Uh, does carrying twins means is it always a C-section, or can we go ahead with vaginal delivery? This is one question which people keep on asking. See, yes, we can. We women with twins do can have vaginal delivery, but again, it depends upon the position of the baby's type of twins as well as the pelvic capacity of the mother. Suppose in case if the first twin, that is the lowest twin, is in cephalic presentation, definitely she can have a chance of vaginal delivery if there are no other risk factors. But certain types of twins like NCMA twins and conjoined twins or twins with complications, usually they will end up in cesarean section. And coming to the lactation, usually women will have the doubt whether the milk production will be sufficient for both the babies. Taking good balanced diet and keeping yourself well hydrated and taking the adequate amount of fluids will improve the milk production, and also feeding the babies at regular intervals will improve the milk production. At the same time, you can have consultation with your pediatrician or lactation consultant in case you have any doubts. So we are coming to the end of session today. Hope this discussion about the twins is useful. To take home message today is definitely carrying twins is a very high risk pregnancy, and once a woman is diagnosed as carrying twin pregnancy, she needs to book herself into a center where she can get the comprehensive care. Uh, um, the with a multidisciplinary team approach involving the obstetricians, fetal medicine consultant, as well as neonatologists, and with a good level 3 NSU, so that suppose in case if the woman delivers preterm babies, they can be taken care of well. Thank you and have a good day.